Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome to Local Doctors on Call. I'm Grant Boxleitner. We'll be discussing acupuncture, and I'm joined by Dr. Stephen Wrench and Dr. Courtney Connell of East West College of Natural Medicine. And in this first segment, we're going to be talking about treating anxiety. Gentlemen, welcome. And Dr. Connell, this first question, in previous shows, we've talked about a myriad of things about treating acupuncture, but I understand that it can also help to treat anxiety, which is what we were just talking about. Is that correct?
Yes, Grant. Anxiety has been a sign, even documented in the ancient texts, as an indication that there could be something wrong with other parts of the body. And even in modern times, we do have a diagnosis of anxiety, and we list multiple causes for it.
And now, is this new information?
Not at all. Like I said, somewhere back in the ancient texts, we differentiate disease, and we diagnose different signs and symptoms. Someone could have anxiety, palpitations, and maybe they have insomnia too, which would mean one thing. And they could also have anxiety, palpitations, and chest pain, and that would mean another thing. And so we've been treating the symptom of anxiety for a very long time.
So how would you figure if a patient had these symptoms and you felt like maybe they were suffering from anxiety, how do you get to that point?
Well, through the interview, they bring us their signs and symptoms. Mostly through conversation is how we discover that they're anxious. Mm-hmm. You can see the agitation in them, but it's a really physical experience that someone might not even understand themselves, and we have to draw it out of them through questioning.
So how does the Eastern versus Western medical viewpoint differ when it comes to anxiety?
Want me to take this one? In the Western model, basically, there's kind of what we call a mind-body disconnect. In the Eastern concept of traditional Chinese medicine, the mind and body are considered part of an integrated whole. So it's possible, say, that I have a broken leg, and as a result of that, I'm unable to work, and I'm inactive, and I'm not bringing in an income, and now I start to get a bit depressed. So Western medicine may tend to view that as, well, the very real thing is that you have a broken leg, so we're going to treat that. The depression sometimes can be viewed, and in all areas of medicine, as sometimes that's a little bit of a flaw, and that's something separate. So we heal the leg, that's very real. The mental thing sometimes is, well, let's give you some antidepressants for that. But in the Eastern sense is we can treat the pain, we usually can alleviate the depression, because we believe there's a connect.
And then is there anything more to that, or does it depend on the patient? Is each patient different?
Every patient's different, yes.
There's some other things I'd like to add on that one.
Sure.
In Western medicine, anxiety is seen as a psychological disorder. So they really define it as problems with the brain, problems with the neurotransmitters and the chemicals in the brain, which is true, could be true. In Chinese medicine, we have a different term for psychology. We understand that our thoughts and our mental world actually affects our body, and they exist together. We call this Shen. It's actually referred to as the heart-mind, and the heart actually holds the Shen. Mm-hmm. So when someone is experiencing anxiety or other psychological disorders, it doesn't mean always specifically there's something wrong with their brain in our medicine. It's actually the entire organ system, and it could point to certain organs like the heart or possibly the liver, which if we supported their function, then the anxiety or the depression could be relieved.
That's really interesting. Tell us a little more about that.
Well, Shen is a very interesting concept in Chinese medicine because it encompasses something we don't have in Western thought, which is the fact that there really is a mind-body connection. This idea that psychology, the things we think affect our health, and that there is a relationship between our heart and our mind and our thoughts. But we do experience this in our day-to-day life when we think things or we go into stressful situations. We can feel it. We get butterflies, or maybe we get we breathe a little heavier. We feel it in our chest. So the connection is there. It's just subtle. So to nurture someone's heart in our medicine is a very prime directive in some methodologies of treatment.
And so we've been talking about the medical viewpoints of both disciplines, but in the treatments, they differ as well, and I think we've been talking about that a little. Is that fair to say?
Yes. In Western medicine, largely, we're treated two ways when we have something that we think is what we would consider a mental issue, mental disorder. And largely, as we know, Western medicine's model is pharmaceutically/surgically based medicine, and we need that medicine, so that's a good thing. But largely, if I go in to my physician and I say, you know, I'm having these issues, more than likely it'll be handled pharmacologically. So I'll take some medications. And then if that's not sufficient, there may be perhaps some therapy that's recommended along with that. In the acupuncture model, we would treat the body more through acupuncture. And interestingly, if I may, there's a study that was done at the University of Chicago and published in the Journal of Endocrinology in, I think, 2013. And they talked about the fact that when acupuncture is given, it actually, and the studies proved, it affects the area of the brain that controls emotions, number one. Number two, it lowers or inhibits the release of our body's stress hormones.
Very interesting. And when we come back, we'll be talking about stress levels and stress relief. Stay with us.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back. Keep up with the teams from across the area.
And I'll be on the sidelines of the Game of the Week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. In this segment, we'll be talking about stress levels and stress relief. And gentlemen, I just want to know, how can acupuncture, Dr. Connell, we'll ask you this, how can acupuncture help with lowering stress levels?
Well, it's actually one of the things acupuncture is used for most frequently, actually, and it's one of the happy side effects, actually, maybe you could call it, of having an acupuncture treatment. It's been shown in many studies that one of the effects of acupuncture is to trigger the relaxation response. Mm-hmm. This may be the state that our mind goes into when we're in meditation, whether it be moderate or even deep.
So is your mind relaxing, or is your body, or both?
Both for acupuncture, right? So when we trigger this effect, right, this is the parasympathetic nervous system is treated. So in Western medicine, they acknowledge that we have our stressed out mode and our peaceful mode, right?
Yeah.
And we acknowledge that they're called sympathetic and parasympathetic. And we in the Western culture, we just get really caught up in our stress mode all the time, driving, everything's driving, watching TV, whatever.
On your phone.
On your phone all the time. We're just constantly stressed out. And I think we're forgetting how to relax. And so all of these methodologies, acupuncture included, is a way actually we can trigger the effect of the parasympathetic nervous system, have that person, what I call, dial down, relax, and get some great rest. It's also been proven that this is the state of the body where it heals. We're not worried about healing when we're stressed out, but when we're relaxed, we heal.
And by lowering stress levels, is it an acupuncture treatment that may involve a series of needles throughout the body, or does it just depend?
There are certain points which are pretty reliable at reducing stress. Some points in the ear are reliable, and mostly points on the hand and feet are very reliable. But every person is unique, and every acupuncture is customized for that person on that day.
So how does acupuncture, Dr. Wrench, for stress relief differ from maybe the conventional medical treatment approach?
Well, again, let's look at the options. We have the prescription drug approach, and then we have the therapeutic approach. One thing interesting to note is that if I go to therapy sessions, I may have I'm going to get three options. I never get better, I get a little bit better, or I get a whole lot better.
Right.
But there's no way of really knowing how many times I'll have to go. So they did a study in China, and they at Guangzhou Hospital in 2014, and they gave acupuncture to 50 people, and then they used prescription drugs to 50 people for anxiety and depression disorder. 89.6% got better on the acupuncture side. And interestingly, 84.4% got better on the pharmaceutical side.
So it was close,
It
but
was
there
good,
was a
and
difference.
They both made a difference. But the good news is, and I think it's promising news, that on the acupuncture side, or that test group, there were no side effects. The people slept better. They had a better sense of well-being. They didn't need to be re-medicated. They had no harmful side effects. Whereas on the other test group, they had to go back, and they became a little bit, in many cases, dependent upon the medicine. So the acupuncture, simply put, allows the body to heal itself more naturally.
Good discussion, and in our next segment, we'll be talking about the acupuncture process along with herbs.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back. Keep up with the teams from across the area.
And I'll be on the sidelines of the game of the week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back. In this segment, we're going to be going into more depth about acupuncture and herbs. And Dr. Wrench, I've heard you before talk about meridians in these discussions about acupuncture. Could you explain to the viewers exactly what these are?
Yes, in ancient times, they were described as little pathways that conduct body's energy throughout the body, like little superhighway system, if you will. in the 60s in North Korea, there were studies done that where there was a process that allowed them to dissect vessels, and within these vessels, through a process of dyeing, they were able to identify what we would consider to be almost like a microfilament. It was so tiny and almost impossible to see. So with a specific process of dyeing, there was a gentleman named Bong Han Kim, a researcher, who found a way to make these visible under powerful microscopes. And so they surmised that this is like a fiber optic system that runs through the body, connecting every organ with every other organ, et cetera. And so we today use the term chi, and I think that's a misunderstood term. We call it life force or vital energy. Really, it's a metaphor for metabolic processes or chemical reactions within the body, simply put. But we believe that chi travels through this little superhighway system.
And is it always doing that, or
it is.
it moments
It can
of
slow down,
dormancy?
it can stop,
Okay.
it can become what we call blocked or stagnant. So as long as our energy is moving, much like electricity through these walls, powering these lights and cameras, as long as those wires are intact, that would be our channel. And the chi, the life force, in that case, is the electricity. As long as it's moving, everything's functional and operational. When that becomes blocked or impaired through lifestyle, diet, through trauma, then there's a blockage. Whenever there's a blockage, we begin to see eventually a disharmony, somewhere a disruption of energy, and then there'll be an effect down the line somewhere.
And so this is something you would diagnose and look for in a particular patient.
Oh, absolutely, every patient.
Now, Dr. Wrench or Dr. Connell, during treatments for anxiety, are the needles actually inserted into the nerve, or how does that work?
Well, none of the acupuncture points are actually in nerves. They actually sometimes are very close to next to the nerve to stimulate it, but not actually put the needle through the nerve.
Because if you put
that
a
does
needle
not
through
happen.
a nerve, that would, I'm assuming, cause pain.
Oh, yeah.
Yeah, but yeah, that's actually, if that happens, we take the needle out. That was put in the wrong place.
I see.
And traditionally, some of the texts refer to acupuncture points as holes. So they're actually areas in between everything else. And then when we know where they are, sometimes we palpate the body and we will feel a little hole, and that is the acupuncture
Now, I
point.
know that the skin is made up of a series of pores. Does that play into anything? Do you look at pores at all?
No, it's more about to identify our acupuncture points. We mostly use landmarks on the body, muscular structures, bony structures, ligament structures, and then we know the distance from here to there, and it's in between.
Okay, and so besides acupuncture for the treating anxiety, let's talk about herbs and what role that plays in some of this approach.
Well, the herbal tradition in China is thousands of years old and very rich, and so we do have an entire category of herbs called calm spirit herbs. So maybe a list of 8 real specialists at calming the spirit and treating anxiety. But honestly, most of my patients that I treat anxiety, I start with diet. It's very important that the person is eating enough vegetables, not too much sugar, and in my view, getting a real good base of trace minerals, like the earth that we eat through our vegetables. This is where you start. B vitamins also become of prime importance, fatty acids, because these actually support brain function, and in some B vitamins, heart function. So I start with diet, make sure that's solid and that they're getting good nutrition throughout their day, apply my herbs, and
So
then
as far as the herbs, what are a couple of the herbs maybe that you would use to treat anxiety? Is there just an example?
well, they're in pinyin, right? Swanzhao Ren, or which is Ziziphus, or we could use Hupo, which is amber. Some of the shells, like actually Longu, Mu Li, and these are abalone, right? So these are
Yeah.
shells out of the ocean, so they're rock substances. So, and they anchor, right? Because when we're feeling anxious, we're feeling like everything's going to fly away from us. So actually, they have this very anchoring function. And so those are some of the typical ones
You might
that I
mention
would
they're
apply.
powdered.
Oh yes, they're
Right.
most of our herbs are either powders. The tradition is based on using root structures or twigs or berries. Right. This is the traditional medicine of humankind from 3,000 years ago.
Fascinating, but don't go anywhere, because in our next segment, we're heading out to East West College of Natural Medicine, and we'll be talking to patients dealing with stress. How does that sound, gentlemen?
It sounds great. We're excited about it. We look forward to it.
All right, we will be back.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental medicine.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back. Keep up with the teams from across the area.
And I'll be on the sidelines of the Game of the Week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
And in this segment, we're right here at East West College of Natural Medicine, and I'm in the clinic theater. I'm joined by Dr. Brandon Fuller, and we've been talking about acupuncture. And as far as patients dealing with stress, how many treatments do you recommend for a particular patient who may be dealing with this?
Usually, we like to see how severe their problem is, their stress level. Usually we say 4 to 6 treatments in the beginning and then go from there.
In this particular room, this is where students get a first-hand look of how it all works?
Yes, that's correct. So generally, in this room here, this is the clinic theater. So what they'll do is they'll be treated by an actual physician, and the students watch and ask questions, and they learn a lot from watching a physician treat.
And as far as recommending continued treatment, I guess it depends patient by patient, but are there some signs that you look for?
Oh, with any treatment, we look for different signs, right? So if a patient's stressed, there could be many factors. It may be work, maybe they've been eating something that's not correct for their body and their body's under stress. Mm-hmm. It could be maybe they have heart problems or digestive problems.
And each individual treatment, give us a sense of approximately how long that could last.
Each individual treatment usually lasts about 20 to 25 minutes.
So how can our viewers at home to learn more about this or to maybe set up an appointment, what do they do?
If they want to make an appointment, they could call our clinic. It's 355-9080.
And there's also a website that they can go to get more information?
Yes, that's correct. And the website is ewcnm.org.
Okay, well, coming up in our next segment, I'm actually going to get a short treatment here, and that should be fun. Dr. Fuller, we'll look forward to that when we come back.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental medicine.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back. Keep up with the teams from across the area.
And I'll be on the sidelines of the Game of the Week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Hello again, I'm Dr. Stephen Wrench of East West College of Natural Medicine, and we're here at the Student Clinic Theater at the college, and our host, Grant Boxleitner, is on the table about to receive his first acupuncture treatment ever.
Yes.
And what we're going to do today, Grant's going to be very, very simple, but it's more than anything else. We've been talking about this in the program about anxiety, stress relief, and so on. So we're going to give you a little mini treatment, and we're going to just put a few needles in your body, 2 in your feet, paired with 2 in your hands right here. And I'll just kind of use my hand here as a demonstrator here. And on the very top of your foot here, just kind of distal to the junction of the first and second metacarpal bone there. And then we're going to do 2 points in your ear. And what's unique about the ear is that it's like a little remote control for the whole body. Number one, its proximity to the brain makes it a fast working point. Secondly, it has an effect much like your TV remote. So we push a button here to make something happen elsewhere. It's also the most superficial aspect of the central nervous system. So this is almost where it surfaces. Chinese figured this out thousands of years ago, and if you look at old Chinese sailors, you saw an earring in their earlobe, and when they would come into port and be asked about it, they would say, it enables them to see far at sea. So when we're looking for a reef or a landmass or a man overboard, you need visual acuity skills. And this is the way it kind of came about. So your ear is like a microcosm of your whole body. And then there's one more point. I'll use my pen just to touch right between your eyebrows here. This is a point that brings a sense of calmness and well-being to every patient. And it's not uncommon for us to do this point right off the bat.
Okay.
Especially if there's anxiety involved. Not that you have any, but...
Yeah, I think everybody has a little bit. But,
so this should be pretty relaxing and fairly uneventful for you.
All right. Well, I'm looking forward to it.
So all the needles are in place now, Grant. And
so for a particular patient, how long would this last, or would you sit here like this?
we would probably keep you on the table in the neighborhood of 20 at the least to 30 minutes at the max. So in a normal treatment, we would bring you in, we would sit down with you for about 20 to 30 minutes or until we get the information that we need, get our needles in place, dim the lights, maybe put on some music for you, and let your body take care of itself. We encourage your body this way to very gently heal itself.
Well, this procedure was pretty much, I barely felt anything, and you've been talking about that, and just, I'm really relaxed right now, so.
Well, what's interesting is in most treatments, the patient actually sleeps through the treatment. So that's a really a great sign that we're free of stress.
Indeed. All right, Dr. Fuller, Dr. Wrench, thanks so much for giving me a sense of what this is all like, and our viewers, for anybody who's interested in this type of treatment.
Well, we're glad that we finally got you to our clinic here for your first acupuncture treatment ever. And now I think we'll take your needles out so you can get on with your busy schedule.
Dr. Wrench, Dr. Fuller, thank you so much. I know I was in good hands. I really appreciate it.
You're very welcome. It's our pleasure.